Thank you very much for listening to my presentation, which is on a piece of work that I've done as part of my PhD, developing a conceptual model looking at cyclical variation of patient-reported outcomes in chronic conditions. My name is Antoinette Davey. I'm from the University of Exeter Medical School, and this presentation is in collaboration with Ian Porter, Joe Coombs, and my PhD supervisors, Avril Muse, Colin Green, and Jose Valderas. So we know from the literature that chronic conditions are rarely stable. In fact, physiological measurements show that fluctuations in chronic conditions do occur, and that severity of symptoms can actually change depending on the time of day. Now, with patient-reported outcome measures, they require individuals or patients to reflect and evaluate their experience of the health condition over varying periods of time. So some PROMs require patients to reflect over a 24-hour or 48-hour period, and some require longer periods for weeks and months on end. And they heavily rely on the individual's judgment and their cognitive processes they use to evaluate their health condition. But what we don't understand is what factors influence these judgments and how actually time plays a part in this, given that chronic conditions are rarely stable and that severity changes depending on the time of day. So I conducted a scoping review of the literature focusing on cyclical variation PROMs in chronic conditions, and I used the concepts drawn from the 33 resulting articles to develop my conceptual model alongside existing models of health outcomes, specifically Wilson and Cleary and Valderas and Alonso. And this is the resulting model. So at the top and bottom, you've got moderators. So these are individual and environmental factors that feed into the core of the model. You've got determinants on the left-hand side, which are disease-specific biological rhythms and timing and type of healthcare interventions. And the variation in outcomes and variation in scores are very much constructs. And in the middle, you've got psychological health status, which does have a bidirectional effect on variation outcomes and has a direct effect on how patients actually complete the PROMs. So from the model, we can see that determinants had a direct effect on variation in health outcomes. Specifically, if you look at disease-specific biological rhythms, so stiffness levels for arthritic sufferers, shortness of breath for COPD sufferers, these were highest upon awakening compared to other times of the day. And also, when you administer an intervention and the type of intervention that's administered also impacted on health outcomes. So we can see that the time of year in pulmonary rehabilitation, when this was administered, this impacted on overall health outcomes, and also the recovery time. So people with cancer, when you take their fatigue levels straight after a chemotherapy session, these will be higher compared to if you take them several weeks later. So from the model, we can see that there's a bidirectional effect between psychological health status and health outcomes. We know that low mood, for example, increases pain experience, but also chronic pain can actually result in a lower mood. And when we look at the moderators, specifically the individual factors, so sleep disruption, that results in worsening outcome scores, but also environmental factors can impact on outcome scores. So increased exposure to sunlight is linked to better outcome scores. And then finally, when you look at the variation in scores, recall bias was quite heavily impacted on. So retrospective accounts can actually lead to patients misclassifying their symptoms or even overestimating their symptoms. And specifically, if you look at the sensitivity of a measurement to detect any changes in outcomes over time and how change is defined clinically, these are important when considering and interpreting results of outcome scores. So in conclusion, we know that cyclical variation from the literature refers to fluctuations of outcome scores over different periods. And in reference to this PhD, the focus here was on two sources of variation. One, the measurement object, i.e. the PROM, and the measurement process, so the appraisal process that people actually used in completing a PROM. And we know that systematic periodic variation of outcomes, so changes during the day reported by patients, could actually have a bearing on the evaluation of any treatment plans that are suggested to patients and also the disease progression. Thank you very much for listening to my presentation, and if you have any questions or comments, pop them onto a comment below the video or send me an email. I'll be happy to respond. Thank you. Bye.